Hello everybody. I'm going to show you how to measure the blood pressure using auscultatory method. There are different ways of blood pressure measurement, but this is the most popular one. Most commonly used method is the auscultatory method by auscultation. That means by listening the sound. Okay. So these are the instruments we are going to use today to measure the blood pressure. This instrument is called the sphygmomanometer. Spelling is SPHYGMO, sphygmo, then mano, MANO, and meter, METER, sphygmomanometer. So three words together. Okay, so this sphygmomanometer has different parts. This part, you see the inflation bulb. So this bulb is called the inflation bulb to inflate the cuff. This is the cuff that we are going to wrap around the arm and inflate by increasing the air pressure inside the cuff. Okay, and to increase the air pressure inside the cuff, we use this inflation bulb like this, and this screw is called valve. So we can open and close this valve. This way is closed and this way is open. Okay, and then rubber tube, this one, and this piece is called pressure gauge, or dial, also called a pressure gauge. And you can see that it has a clock-like numbers inside, and this is the indicator needle, and this way you see when you increase the pressure in the cuff, the indicator or this needle will move up clockwise, and when you will release the pressure inside the cuff gradually, that we are going to do, the indicator will move anti-clockwise. Okay, and this is the cuff that we put or wrap around the brachial artery, that means around the arm. Okay, so those are the parts of the sphygmomanometer. And then this instrument is to listen the sound. Okay, and that sound we are going to listen is called the sounds of cord cuff. So by listening the sounds of cord cuff, we will determine the blood pressure, systolic and diastolic pressure, and that's why this method is called auscultatory method. Okay, now this stethoscope, its spelling is STETHOSCOPE, stethoscope, to listen the sound. And this part is called the diaphragm. So you see a membrane like structure here, and then the back of this chest piece, this part is called the bell. So this whole thing is the chest piece, and it has a diaphragm, and by rotating this chest piece, you can turn the sound on and off. So when you will start to measure the blood pressure, you make sure that it is on. How you will do that? You will put these ear pieces in your ears, and then you will tap the diaphragm. Very soft touch with your finger, and if you hear the sound, that means it is on. If you don't hear, then you have to turn it on by moving like this. Okay. So again, this is the diaphragm of the chest piece. In the back, this is the bell of the chest piece, and this is the rubber tube, and these two are called binaural, and these two are ear pieces or ends. So those are the instruments and their parts. Okay. Now first, what we'll do, we'll ask the patient or the person who we are going to take the blood pressure from to sit comfortably, relaxed. Okay. And then put the forearm like this on the table, and then what you'll do, it's a good idea, you take the clothes off, and then wrap the cuff around the arm. So make sure that these tubes are downwards. Okay. So like this, in the middle of your front of the arm, and then I will just make it tight around my arm. So just do like this. Okay. So now it is pretty well set around my arm. Now what I am going to do, I am trying to feel the pulse from the brachial artery. Okay, in your arm you have the brachial artery, and you can feel the pulse from the brachial artery just a little bit medial of your cubital fossa. Okay, so just above and medial this way towards you, you can feel the pulse by pressing. Okay, and this is the location where you are going to put the diaphragm of the stethoscope. Okay, this part, this is the diaphragm, it will go here. Okay, like this. Okay, then as I told you, you have to make sure that you are listening the sound. Okay, so this one supposed to go like here, but you can put on the desk too, that is fine. And then make sure that your inflation bulb you are holding with one hand, and these two fingers, this is important, your thumb and index finger, these two are going to be used to screw, close and open the valve. Okay, so this way it is open and this way it is closed. Okay, so I am going to put this in my ears like this. Okay, and then you can put the pressure dial or gauge here. Now I am going to make sure that my diaphragm is here, and then going to increase the pressure by pressing the pressure bulb. Okay, you see the pressure is going up here in this meter. You see, go all the way to 160. If you go beyond that, it may cause pain. So here you see 160, that pressure is enough to close the brachial artery. Okay, now I am going to release the pressure slowly by releasing this valve, okay, with my these two fingers. So you see it's going downwards, and you can also see the needle is moving downwards anti-clockwise, and you will wait to hear the sound. Okay, the first sound that we'll hear, that is the systolic, and the last sound that we'll hear before it disappears, that's the diastolic. Okay, so I am unscrewing, releasing the pressure all the way. Okay, now doing again. So let's move it. So I am increasing the pressure around my arm to close the brachial artery all the way, and 160 here, and now I am releasing the pressure and waiting to listen the sound. Now I heard the first sound of cork cough, 120, and still I listen the sound. Okay, now it disappeared, no more sound, so around 80. So my blood pressure, systolic pressure is 120 and diastolic pressure is 80. Okay, so 120 millimeter of mercury over 80 millimeter of mercury. Okay, so that's how we measure the blood pressure using the auscultatory method, and we can determine the blood pressure by listening the sound. Okay,